Lymphedema is a chronic condition of swelling that can progress through stages over time. While there's no cure as of yet, consistent self-care can help slow or prevent this progression. There are 4 key internationally recognized strategies recommended for lymphedema maintenance, also called pillars of self-care. Compression is a key pillar of lymphedema management. In fact, research shows that of all the recommended strategies, compression is used the most. But not many people with lymphedema know how their compression works, and more importantly, do not know how to tell if their compression is working for them. My name is Kathy. I'm a registered nurse, registered massage therapist, and certified lymphedema therapist, and I'm here to help answer those questions for you. In this educational session, you'll learn why compression therapy is essential in preventing lymphedema progression, why the right fabric and fit are needed for best outcomes, and how to assess if your compression is working. To support your learning, I've also written a self-assessment guidebook that you can download from my website, and I will link that in the description box below. So, grab something to write with and to write on, make yourself comfortable, and let's get started. The use of a compression garment for lymphedema maintenance has many benefits. It not only helps blood flow in the veins, but also encourages fluid into the lymphatic vessels and stimulates contractions of the lymphatic vessels. It improves the environment of the tissues by decreasing inflammation and enhancing the removal of wastes within the tissues, which can help wounds heal and prevent tissue thickening known as fibrosis. Compression can be used in a couple of ways. Intensive compression can be used in the initial stages after diagnosis of lymphedema or intermittently during the maintenance phase to control swelling. The goals of using intensive compression products are to reduce the amount of fluid in a body part, therefore reducing its size, also to enhance tissue health and to help soften the tissues. Intensive compression can involve the use of multiple layers of bandages or a Velcro-style garment. These compression products are worn consistently throughout the day, usually 23 out of 24 hours a day, with that hour without compression used for hygiene purposes. One suggestion I give to my clients is to try intensive compression once a year before being fitted for a new garment, just to see if there's any reduction that can be achieved before getting into their new maintenance garment. Maintenance compression is just that. It's meant to maintain what you have achieved while wearing the intensive compression garments. It helps both blood and lymph circulation and helps to keep your tissues healthy. Your maintenance garment is worn daily from within an hour of waking until you take it off for sleeping. The type of garment you wear depends on many factors. When working with your garment fitter, abilities such as being able to bend over to put on leg stockings, or even your grip strength and conditions that cause pain or joint mobility issues should be taken into consideration. If you have trouble putting your garment on, it's going to affect whether you can or will wear it. And so a Velcro-style garment may be a better option for you than a fabric garment. When thinking about the garment that will suit you best, take into consideration the areas that are swollen. Your compression garment should cover all swollen areas. So for example, if you have foot, lower leg, and knee swelling, a thigh-high or pantyhose style garment will be much more effective than just a knee-high garment. When it comes to arm and hand swelling, a glove will be more effective than a gauntlet for people who have finger swelling. Maintenance garments can also include special night garments. Wearing your day garment overnight is not usually recommended by garment manufacturers because they may bunch up with movement during the night to cut in and affect blood flow, potentially causing pain, and they may cause skin irritation as well. There may be times when night compression is necessary, such as in hot and humid weather. This is when swelling can worsen. During these times, you can use your intensive phase bandages to reduce overnight and then go back to your maintenance garment during the day. Compression garments for lymphedema are categorized as medical compression. Not all garments are made equally, and some, such as sports compression garments, are not recommended for use with lymphedema. Please make sure you consult with your doctor, certified lymphedema garment fitter, or lymphedema therapist before purchasing your first maintenance garment. Compression garments have certainly changed over the years. Improvements in function and fashion have made wearing compression less of a burden. It is important, however, for you to remember that the goal of maintenance compression is to prevent lymphedema progression. It's also important for you to know that the choice of a compression garment for you involves many factors. Choosing a garment that will be good for you can be a bit complicated. Should you have a circular knit, otherwise known as a round knit, stiffer knit garment, or a flat knit garment? It is your stage of lymphedema, the presence of tissue hardening, the size of your limb, and location of swelling that helps determine the style and fabric of your garment. These and other factors such as circulation status and sensation quality all influence what type of garment is best suited for maintenance of your lymphedema. This is why being assessed by a certified lymphedema garment fitter is essential. Compression garments can be made with varying pressures and varying fabrics to meet your specific lymphedema needs. Since lymphedema is not a static condition, over time, changes in each may be needed. Knowing the pressure, fabric type, and function of each can help you when you are assessing whether your garment is working for you. Compression garment manufacturers use varying yarn systems that are interwoven with each other to produce the fabric of the garment. Adjustments made to these yarn systems change the thickness, texture, and appearance of the garment. As you can see at the bottom of the screen, stiffness increases and elasticity decreases as you move from left to right through the different fabric types. The stage of your lymphedema determines which garment is best for you. If you have mild lymphedema with no tissue changes, meaning your skin and underlying tissues are soft, a circular knit off-the-shelf garment will most likely work well for you. However, if you have some thickening or hardening of tissue in your limb, or your swelling is not being contained by regular circular knit garments, you may need to wear something a bit stiffer. Flat knit garments are usually ordered for those whose limbs are larger, are not a uniform shape, or for those whose swelling is not contained by circular knit garments. Velcro garments have a higher stiffness and can be used for later stages of lymphedema as well, and are typically chosen when knitted garments are too difficult to put on and take off, or when flat knit garments cause discomfort due to cutting in at larger skin folds, the elbow, ankle, or back of the knee. Garment pressures work together with the fabric type to control lymphedema. They are expressed in millimeters of mercury or by the symbols mmHg. Lower pressures are typically used for mild swelling with no skin or tissue changes, and for those who are unable to tolerate higher pressures due to circulation or sensation issues. Higher pressures are needed for higher stages of lymphedema that need both firmer fabrics and high pressures to maintain limb size, limb shape, and tissue health. Garment pressures need to be prescribed by your doctor. So when we talk about pressures, another thing to understand is that fluid moves from a higher pressure to a lower pressure. This is why compression garments have a graduated compression that is highest at the base of the limb, such as the ankle or wrist, and decreases as the garment gets closer to the trunk of the body. The example of a thigh-high garment is given to you today in this chart. And as you will see, I've included circular knit, stiffer circular knit, and flat knit garments. Each has 100% of compression, so the 20 to 30 at the ankle. And as you can see, as it gets closer to the trunk, the compression levels decrease. So a circular knit at the thigh will only have 30% of the 20 to 30 compression, or will only be exerting 6 to 9 millimeters of mercury in the thigh. whereas a flat knit will be exerting 75% of the pressure, or 15 to 22 millimeters of mercury. And this is important when choosing a garment, to take this into consideration. If you have lower leg and thigh swelling, you may do better with a flat knit garment than a circular knit garment. Other chronic conditions such as diabetes or high blood pressure can be managed by medicine. Right now, there's no medicine available for lymphedema, but compression can be considered a non-chemical form of medicine for your lymphedema. Hi again. Okay, that was a lot of information. So why don't you just take a nice deep breath for a minute while I review part 1 before we go on to the next session. All right, so we started out by talking about how compression is important for not only circulation of the blood, but also for lymph flow in the body in order to help control lymphedema and maintain a healthy environment underneath the skin to prevent lymphedema progression, to prevent inflammation, and also to prevent the possibility of infection. We also learned about how compression pressures work together with the material of the garment in order to maintain your lymphedema. And if it's not maintaining, we talked about how you may need to either increase the stiffness of the garment or increase the pressure, which again is a conversation that needs to be had with your doctor and your certified lymphedema therapist or certified lymphedema garment fitter. Recognizing when to use intensive and maintenance compression is important for self-care, and that intensive compression can be used once a year to help reduce your limb, if it will, before you get into another maintenance garment. So take a minute, refresh your drink if you've got one going there, and I'll see you in the next slide when you're ready. And we'll talk about how you can identify whether your compression garment is right for you. See you soon. Welcome back. So here's where we talk about the 5th pillar of maintenance, which is your self-assessment. And in this case, we're talking compression, so we're doing a compression check. So many options exist for compression use, and it's extremely important to recognize if your compression garment is working for you. You may only see your lymphedema garment fitter three times a year, maybe 4, sometimes even less. And so this is where doing your own self-assessment becomes vital. You wear your garment daily and are able to see and feel how your garment functions for you. Through self-assessment, you'll be able to detect any problems associated with your compression and be able to have an informed conversation with your certified lymphedema garment fitter to ensure your lymphedema is maintaining well. So in order to assess your garment, we're going to be asking questions today about your garment, but you also really need to assess what your tissue feels and looks like, as well as the circumferences of your limb. And in order to do that assessment, you can find those instructions in the Pillars of Self-Care video I made for skincare. They all kind of work together in order to figure out whether your skincare routine is working, whether your garment is working. And why are we doing this? Because the answers to these questions will give you an idea of whether you need to change the garment fabric, change the garment pressure, or change the garment itself, whether you need to go from a knee high to a thigh high, whether you need to go from a gauntlet to a glove. These things can all come about as a result of you assessing yourself. It'll also give you an idea of whether you need to do some intensive compression before you get into your new maintenance garment. If you have increased swelling, or if you're noticing that the garment isn't containing your swelling, you can go back into intensive compression before putting that garment back on or getting a new garment as well. But without doing the assessment, you wouldn't know to do that. And that can lead to an increase in size of your arm because you haven't noticed that your arm is increasing even though you're wearing your garment. It can also give you an idea whether you need to see someone else, such as a lymphedema therapist, for a brush up on your self lymphedema massage. When it comes to compression as medicine, I've drawn on my nursing experience to come up with the 3 rights of compression therapy. For the best outcomes, you need to be wearing the right garment with the right compression and know when to use the compression for maintenance or reduction purposes. So it needs to have the right timing. When going through the assessment questions, it's better to answer all questions for each category and then look at the results. Some questions can apply to more than one right of compression. So when we talk about the right garment, we're actually talking about the fabric and the style of the garment. There's certain questions that you can ask to make sure that your garment is the right one for you. Your garment needs to cover all of your swollen areas. If you've had more than one infection, particularly cellulitis, in the last year, you may want to talk to your garment fitter about the fabric of your garment and whether it has any antibacterial properties. Stiffer fabrics tend to help with hard, lumpy, or bumpy skin and help keep the limb in a uniform shape. Ask yourself, does my swelling get worse as the day goes on? This is a question you'll probably ask yourself a couple of times because it does apply to a few different rights of compression. In this case, if your garment is allowing your swelling to get worse as the day goes on, it probably means that it's not the right fabric for you. Does my garment cut in or hurt? Again, this is maybe a fabric issue, and you need to talk to your garment fitter if your garment is causing you pain and it's leaving red marks and cutting into your skin. Do I have trouble putting on or taking off my garment? If you're having trouble with this, you may want to talk to your garment fitter about possibly changing to a Velcro style garment. So the second category is the right compression, and this we're talking more about the dose or the pressure of the garment. So those millimeters of mercury pressures we talked about earlier. So garments do tend to get what the garment manufacturers call fatigue over time. They call it garment fatigue, and you lose a certain amount of compression every month when you wear a garment on a regular basis. And so this can make the garment looser, it can make it fall down, it can make it more easy to put on, which most people think is a bonus, but it actually may be a sign that it doesn't have the right compression. It might be a little tired. So ask yourself these questions. Is my garment older than 5 months? Is it loose and easy to put on? Is it out of shape? Does it have runs, tears, or holes? This will give you an idea that it may be time to get a new garment. Washing your garment regularly helps to bring it back to its close to original compression level. And does your swelling increase as the day goes on? So here's that question again. That might mean that either your garment's too old or you may need a higher compression. And I cannot put my garment on or have great difficulty doing it. So for some people, pain, the garment can cause so much pain, you might need to lower your compression. But again, this would be a conversation with your doctor and your compression garment fitter. So the right timing. This means we're talking here about can you continue on with your maintenance compression garment, or should you do maybe some intensive compression for a little bit? So how do we tell? When you're doing your skin assessment, you will find if you have more fluid, you'll find that your finger will leave an indent when you press into your skin. This is an indication of definitely fluid, probably movable fluid that you can get out of there with your intensive compression. Do your clothes, shoes, jewelry feel tighter than usual? Could be another indication that your limb is swelling, and it may be time to do some intensive compression again. Did my self-measurement show that my limb has increased in size? So again, another indicator that some intensive compression is probably indicated at this time. And do you have any new or worsening swelling? So for numbers 1, 2, and 3, if you answer yes to these, most likely a trip to your garment fitter or your lymphedema therapist can guide you. But if you have any new or worsening of swelling, it's best that you see your doctor first. Any new or worsening swelling should be assessed by your doctor. Okay, so we're at the end of our educational session for compression. I hope you enjoyed this video and found it helpful. If you have, please press the like and subscribe to get notifications for when new videos are made. By doing that, it helps other people to see these important videos as well. So in today's, just as a review for today's session, basically, we wanted to get across how important compression was for lymphedema maintenance, but also how self-assessment allows you to have not only informed conversations with your garment fitter and lymphedema therapist, but how it also helps to prevent lymphedema progression and any associated complications with lymphedema. Don't forget to download the free PDF I made. It's a guidebook that goes along with this video. And I hope to see you in the next video. Take care.